Over the past month on Gut Check, we've shared deeply, I'm having some issues with my prompter, so I'll read from here. We've shared deeply personal stories. We've spoken to medical experts and also organizations helping raise awareness and address stigma relating to colorectal cancer. One patient-focused organization is the Colorectal Cancer Resource and Action Network. And joining us this morning to talk more about the work they're doing is Cassandra Macaulay, Chief Research Officer. Cassandra, good morning to you. Thank you so much for joining us on our last segment of Gut Check for the month. It's great to have you here.
Good morning, Lisa. Thank you so much for the opportunity to speak with you today.
Absolutely. Let's get right into it. I mean, the talk of our conversation over the past month is we obviously know that those 50 and over are at risk, but we're talking about those 50 and under who are now in even greater risk of developing colorectal cancer. And, you know, some patients not showing signs or symptoms, others are. Let's talk about what seems to be a huge void in patient advocacy. Can you talk about the network and why it even started in the first place?
Absolutely, yeah. So the Colorectal Cancer Resource and Action Network, or CRAN as we're more affectionately known, really originated as a grassroots colorectal cancer information and support group back in 2006. After the passing of our founder's father due to metastatic cancer. Today, CRAN has very proudly become a national, not-for-profit, patient-focused organization dedicated to support, education, and advocacy for colorectal cancer patients and their caregivers with an expanded mandate across tumor types. Our ultimate goal is really to reduce the burden of cancer in Canada. In terms of advocacy for younger patients specifically, you know, there really is a gap. Our cancer care systems are divided by pediatric and adult cancer care. But the adult cancer care systems are really designed for older individuals who are experiencing cancer, and there's very little in between. So early age onset cancers, which are the cancers that are diagnosed before the age of 50, are really on the rise, not only in colorectal cancer, but across multiple cancer types. And I think we really need to, rethink, re-envision what the experience of living with cancer looks like, both at a healthcare systems level and at a societal level, so we can best support the younger adults managing cancer.
Something that I think really stands out with your organization is obviously that you are a patient-focused network. So patients that are currently experiencing this disease or have maybe hopefully made it to the other side and maybe have, anything post-journey that they're still dealing with, that's something that you guys can help them with. But something that for me really stood out as well is the fact that you help in caregivers, because we talk about cancer being a family disease. Myself, when my mom was first diagnosed with rectal cancer, I was about to deliver my son. I didn't even know where to start with her situation. And so, the caregiver aspect of this situation is something that's really vast as well and important.
Yeah, Lisa, we have a saying at CRAN, and that is that the first place that a cancer spreads to is the family. And, the care partners, the family members, they truly go through their own cancer journey alongside the patient. As such, all of CRAN's programs and our resources are available free of charge to any and all caregivers and family members. Everybody deals with cancer in their own individual way, and it's really important to us as an organization to be there for everyone who is impacted by that cancer diagnosis.
Mm-hmm. Can we touch a little bit on the Bum Run, because I know you guys have some involvement in that as well?
Absolutely. So Bum Run is our annual fundraising event. It is a family-friendly walk-run event happening at Queen's Park on Sunday, April 27th. And it's a really wonderful opportunity to raise awareness of colorectal cancer and also fundraise to support CRAN's patient-focused programs. So we would love to see as many people as possible out there. We'll have our jumbo colon, which is an inflatable reproduction of a human colon that you can walk through and learn about the various pathologies of the colon. Our CRAN team will be there, and we're just raising awareness and saving lives with the knowledge that colorectal cancer is highly curable if it's caught early.
That's the message that we've been trying to raise here for at least the past month. I know it's some of the work that you guys are doing, and these interactive things that we have, like at the Bum Run and the Big Colon, are things that people, I think, sometimes just need to see to understand how dire the situation really is. Quickly, Cassandra, where can people get more information if they're seeking it?
Yeah, people can get more information at our website, www.cran.org. And honestly, if you or a loved one is experiencing colorectal cancer, it would be absolutely our privilege to be able to support you and provide you with information throughout your journey. So please reach out to us. We'd be more than happy to have a one-on-one call and introduce you to our various programs and resources.
Cassandra Macaulay, it has been such a pleasure having you on the show this morning. Thank you so much for joining us on our last segment of Gut Check on CP24 Breakfast.